My name is Brooke Ward. I'm the President and CEO of the Washington Healthsystem. My honor to be with you here today, and again, I appreciate you coming. It's also my honor to take this opportunity to support the Healthcare Heroes and Public Health Preparedness Act, otherwise known as the HEROES Act. The financial support potentially provided by this act will empower community-based healthcare providers such as the Washington Healthsystem to help create programs that focus on building workforce and forging innovative partnerships and address healthcare needs at the local level, many of which you'll hear about today. The Washington Healthsystem is proud and honored to serve the Washington Healthsystem, our community, throughout the pandemic, and we look forward to strengthening our system to continue to be able to serve our community through all circumstances. Here today with us, we have a number of Washington Healthsystem leaders and physicians, along with some state officials, including Senator Cameron Barlotta, Representative Tim O'Neill, and Representative Pam Snyder, all of whom will speak today. I appreciate them all taking time out of their day to spend a little bit of moment with us to help support this HEROES Act, which we find vitally important for our healthcare community and the hospitals across the state. So with that, I want to turn it over to Senator Cameron Barlotta to start us off, and we'll go from there. Senator?
Thank you so much, Brooke, for that kind introduction. As Brooke mentioned, I am State Senator Cameron Barlotta, representing the 46th Senatorial District in southwestern Pennsylvania, which includes Greene County, most of Washington County, and parts of Beaver County. Rural areas, like the ones that I represent, rely heavily on local hospitals to meet the healthcare needs of our region. The long-term health of rural Pennsylvania depends on these facilities. Throughout the COVID-19 pandemic, I observed firsthand my district's hospitals take a leadership role in testing, treating, and vaccinating residents within our communities. Truly, Pennsylvania's healthcare workforce has shown true heroism during the COVID-19 response, and we need to ensure that it remains supported and robust now and into the future. Many healthcare workers are in need of behavioral health support, wellness, and resiliency programs. In the wake of the pandemic, some healthcare workers moved up retirement plans or left the workforce, sometimes due to stress from the pandemic or due to meeting challenges such as the lack of childcare. As the chair of the Senate's Labor and Industry Committee, I understand the importance of programs like this for our Commonwealth, as well as the need for educators to train the next generation of workers, including those employed by the healthcare field. Hospitals have implemented more innovative ways to deliver healthcare to patients, including telehealth. These changes require significant training and resources in order to ensure that healthcare workforce can keep pace with technological innovations. In recognition of the essential role that rural hospitals play in meeting the healthcare needs of many Pennsylvanians, I am proud to sponsor the PA HEROES Act in the Senate. My legislation will empower our hospitals to find innovative solutions and develop key partnerships to keep our public health system strong. This legislation will also make sure that we maintain a strong public health infrastructure in the towns that we call home. As we look ahead to rebuild our healthcare system, we need to make sure that our workforce, who are family, friends, and neighbors, remains resilient, and that we have the programs and resources to train the next generation of healthcare heroes. No one understands these needs, challenges, and opportunities better than Judy Devaney, Director of Operations for the Washington Physicians Group. Judy, the floor is yours.
Thank you. I am so grateful and excited to be here today to share with you some of the approaches that we have been able to do here at the health system. Approaches for staff recruitment and also turnover. This is our MA in training program that we have recently created and developed. But before I tell you about this program, I wanted to give you a little background information. The MA profession has had significant decreases in enrollment in a lot of our local career opportunity schools. These opportunities for students coming from out of high school to go into these programs, the enrollment has been decreased, which is a way that we get medical assistance for our health system. The cost of a traditional medical assistant program is approximately $24,000, and this is an 18-month commitment, 8 hours a day, Monday through Friday. The starting pay rate for a brand new medical assistant coming out of a program is approximately $15 an hour. MA job postings that we had very little amount of people applying for these jobs, or we had a vast number of people applying for this position that did not have the qualifications to perform the duties of a medical assistant. Medical assistants are critical in staffing our offices and supporting our physicians, also delivering quality care for our patients in our hospital outpatient offices. Currently, we have 83 medical assistants supporting 33 offices and over 121 providers. We have 10 open positions at this time, and some of them have been open for over a year. Turnover rates for medical assistants at the WPBG level at fiscal year 19 was about 29%. And as for the Washington Hospital Family Medicine residency program, the medical assistant turnover rate was 33%. And this is why we had to look at a way to develop and create positions for these medical assistants and get them into our offices. We looked at the feasibility of developing a program sponsored by Washington Healthsystem, also using career steps and Southwest on-the-job training services. We recommended identifying 4 to 5 applicants with an interest in working in these positions and then hiring them into our facility as a student position. These participants will be hired as a full-time student employee into our health system, and they are paid an hourly wage. Career Step is the online training solution that will provide the didactic education, which is completed in a consolidated time period of 4 to 5 months. This education is all done online, and the program is approximately 492 hours. We've also teamed up with Southwest Pennsylvania Training Services that will help us with recruitment of applicants and also provide a portion of the on-the-job reimbursement that they can for qualified applicants. The financial support will be used for wages during this on-the-job training portion of the program. Washington Healthsystem will utilize our School of Nursing simulation lab, and also all of our WPG physician offices as well as our residency offices in order for them to receive the clinical hands-on experience, which is another 300 hours of completion in addition to the online portion of this program. Washington Healthsystem will be hiring these individuals after they complete the portion of the clinical hours as well as the online program. What we also require is that each participant sign a 2-year commitment to work agreement. We started the program with 4 applicants in April of 2020. All 4 completed the program in September of 2020, and they were hired into our practices as full-time medical assistants. I'm happy to say that 3 of the 4 are still working in our offices at this time. Due to the success rate of the program and the demand of additional medical assistants, our second class started in January of 2021. 4 participants are on track to complete this program in June of 2021. Because of this success, we have now started our 3rd class recruitment, and we are gearing up for a start date of July 2021. We definitely expect to offer this going forward because of the success rate that we've already had. This is an opportunity for us to train and be able to help the people in our community, people that want to work, people that want to have a profession in the medical field but maybe never had the opportunity to do so. And this is a way that we can offer this to them so that they can help us and we can help them.
So my name is K.Jo. Fisher. I am the Emergency Preparedness and Clinical Educator for Washington Healthsystem Emergency Department. So federal funding plays a pivotal role in ensuring that local healthcare systems have the resources necessary to effectively prepare for and respond to emergencies and disasters such as the coronavirus pandemic. We do so through the 4 phases of emergency management: mitigation, preparedness, response, and recovery. The first phase, mitigation, we try to prevent future emergencies and take steps to prevent or reduce the cause, impact, and consequences of a disaster. For Washington Healthsystem, this meant using previous federal funding we received through HRSA and ASPAR to purchase sufficient supplies of N95 masks, gloves, Tyvek suits, and goggles in the event of an infectious disease, outbreak, or hazard such as the COVID-19 pandemic. Thanks to this preparedness, WHS had a supply of PPE to be utilized throughout the healthcare system to help sustain us when supplies were otherwise not available across the country. We also constantly trained our employees for emergency situations such as nuclear, radiological, biological, chemical, or even trauma events. WHS takes an all hazards approach, which was applicable to this pandemic. In phase 2, which is the preparedness phase, we take actions ahead of time to be ready to respond to any emergency. The preparedness phase occurs before the disaster takes place. It is designed to predict and to understand how a disaster might affect overall productivity and the bottom line. This phase is when we provided appropriate education to our staff and to cross-train them to work in other areas of the hospital, in addition to training on how to use unfamiliar equipment and new equipment such as the Max Air breathing apparatuses. Simultaneously, putting preparedness measures into place, such as conversion of our standard patient care rooms into negative pressure rooms for placement of suspected or confirmed infectious patients. During the preparedness phase, WHS continuously monitored the threat and subsequent spread of the virus in our area. We implemented our emergency operation plans for expected surge patients, including ramping up our supplies, monitoring our PPE usage, and preserving those supplies wherever possible. Additionally, staff was re-educated on proper donning and doffing of the appropriate PPE, as well as proper hand hygiene. WHS planned for the closure of non-essential procedures and departments, and so much more in preparation for the response to the coronavirus. In phase 3, the response phase, we took action to protect our community and our property in the wake of an emergency, disaster, or crisis. The response phase occurs immediately after the aftermath of a disaster, or in this case of the COVID-19, and the ongoing duration of this pandemic. This is the time that we focus our attention on addressing immediate threats to people, property, and businesses. Patient safety and well-being largely depends on our preparedness levels before disaster strikes. Washington Healthsystem was able to carry out our surveillance, epidemiology, laboratory capacity, infection control, communications, and other response activities. We monitored county and statewide COVID numbers and constantly reported on our hospital testing capabilities and positivity rates. WHS created 2 COVID testing sites, and we purchased equipment to enable to process the urgent COVID swabs internally, and which provided us with a more timely results for those patients. We collaborated with our local and regional hospitals to determine best practices in caring for our COVID-19 patients, sharing successes and helping to troubleshoot when needed. We initiated 3 dedicated respiratory clinics to treat patients with COVID and flu-like symptoms. We implemented telehealth services whenever possible. In phase 4, the recovery phase, we seek to rebuild and return operations back to normal. And while we are still in the response phase of this pandemic, we are slowly starting to move back into the recovery phase. which means creating strategic protocols and action plans to address the most serious impacts of this pandemic while reducing vulnerability to future disasters. Financial support through HAP's proposed Healthcare Heroes and Public Health Preparedness Acts would be extremely helpful to local healthcare organizations like Washington Healthsystem, who are working to recover from the toll of this pandemic that has taken on our workforce and our organization, while also preparing us for what lies ahead in the future. Funding will improve our capability with surveillance, laboratory testing, data management, equipment, supplies, infection control measures, surge management, staffing, emergency operations, and coordination. In short, the proposed Healthcare Heroes and Public Healthcare Act will help us to recover from our losses and costs incurred during the coronavirus pandemic. It will help to prepare local healthcare organizations to better care for their communities through whatever unknown lies in the future. Thank you.
My name is Richard Ajay, and I'm the medical director for the Center for Mental Health and Wellbeing of the Washington Healthsystem. It's an honor to be here today to address you all. I'd like to talk mostly about what we would like to do. Like everybody has mentioned, mental health has been under a lot of stress since the pandemic. Now, most of the problems we have now in behavioral health were pre-COVID, but they've been worsened by the COVID pandemic. And so I hope we can get this grant to address some of the needs that we are currently struggling with, to support or expand current programs, and also to create new ones. Usually, we have the last resort after every other community-based mental health services have failed, particularly our emergency room. And so what I would like to suggest is that our emergency room needs a lot of assistance. We usually have patients who are in crisis that cannot be admitted to our unit because of aged children. We're having an influx of children. There's no hospital-based capacity in the state of Pennsylvania. So we are having to keep children for 3-4 days in the emergency room while looking for a hospital that could take them. So also we do have adults who kind of fall between. They don't meet criteria to go inpatient. They really cannot be discharged home, maybe because they are homeless, they don't have a safe home environment. Usually drugs and alcohol are involved. So we need funding to develop a program that can meet these needs. We also will need funding for like an intensive outpatient program for adults who are in crisis and cannot or shouldn't wait to receive services in a conventional outpatient clinic for various reasons, such as long appointment time, transportation logistics, child care, particularly, a substantial proportion of our patients lives in rural areas. And like the representative mentioned, some of them become teachers, right, because the kids, they don't go to school, unable to keep appointments, bad internet connectivity. We do need assistance to develop telehealth to meet these patients right there when they need the treatment. Oftentimes, if you pick up your phone now and call to schedule an appointment for therapy or to see a psychiatrist, you'll be lucky if you can get it in 3 months. When a patient is in the emergency room, he cannot wait for 3 months. So we need to be able to develop a program that can address that kind of a need in real time. Because oftentimes, if you don't deliver it there and then, they get disenchanted and they do not return back to care. Also, we need to look, even though Washington and Greene counties you might think is rural, we are beginning to have an influx of homelessness. So we're having problems in discharging patients just because they're homeless. The only local shelter we have, as is a mission, for about 6 months would not take any person. So we are getting stuck where you have patients that can be discharged. We have no place to discharge them to. And because of this, you see, it becomes a vicious circle. They are non-compliant. They get readmitted to the hospitals. They have ongoing substance abuse problems. Those are things we need to address. We also need to look, you cannot really separate mental health from addiction. Oftentimes, both coexist. We need to be able to have a program like in the emergency room. When we have, like you know, we're having influx of substance abuse problems. It used to be opiates. That's subsiding, but now we are getting inundated with meth. So you have patients who are showing up in the emergency room. Family is concerned, and there's nothing you can do. We need to be able to develop a program where that they can be managed in the emergency room, and then they can be transitioned to maybe a rehab. So, and last but not the least, charity begins at home. I think we need to address the resiliency of our staff too. We do not, apart from the EAP, which is not readily available, is there, but if the staff is going through crisis, we really don't have someone who can intervene right away. We need funding to be able to develop a program that can support our staff. So that's some of the suggestions I have. Obviously, if you have any questions or concerns, or after this is over, you can talk to me, and I'll be glad to answer some of your questions. Thank you.
Thank you, Dr. Ajayi. Thank you, Tim, as well. I appreciate that. So hopefully you can tell that the PA Heroes Act is tremendously important to community health organizations such as us. It'll help support workforce development programs like we've started here and others that we're thinking about starting, disaster preparedness of all types, including the coronavirus, and mental health needs and access to mental health, which is critically important. And we need to get rid of the stigma that goes along with mental health. All three of these are important. This grant program, this act will help fund all of those across the Commonwealth of Pennsylvania. I appreciate you taking time out of our day today. I'm going to turn this over to Rachel from HAP. I also appreciate HAP's partnership in pulling this event together, but also the proposed legislation.